I'm Rick Sederson, and I am the interim dean of the College of Health. And it's my great pleasure to serve in this role and to welcome you today to one of our college's signature events. And it's great to see so many partners and friends here in the audience in person, and we know that there are many of you also online. The Tammy Bray Endowment in Health, Leadership, and Innovation brings high-profile health leaders to campus to inspire our students, our faculty, and our community. The endowment was established by Tammy Bray, who's here with us today. Tammy is a beloved former dean of our college, and the endowment was established by Tammy and by her late husband, John, with much appreciated contributions from alumni and many other supporters. We're also very pleased today that her son, James, is with us. Welcome, James. So thank you, Tammy, for giving so generously and for creating this endowment. So for our speaker this year, we thought about lots of things we'd love to have. We wanted a health leader and innovator who could draw attention to our incredible athletic training program. That athletic training program is having its 50th year anniversary this year. So round of applause. We also wanted someone who could share lessons in leadership that are pertinent to the many disciplines and fields in our college. And our college is composed of 3 schools: the School of Exercise, Sport, and Health Sciences, the School of Nutrition and Public Health, and the School of Human Development and Family Sciences. So a very broad spectrum of disciplines and fields. And we wanted to make sure we could find somebody whose messages would resonate with all of those things. We wanted a leader who could also inspire our students who are interested in careers in medicine and a variety of other health professions, and many researchers here on our faculty who are interested in the same things. So that is a tall order. But we found all of these things, as you'll see, in Dr. Kimberly Harmon. And so I'd now like to invite Mark Norcross up to introduce Kim. Mark is a professor of kinesiology and also associate dean for strategy and administration here in the College of Health. Mark?
Thanks, Rick. So good afternoon, everyone. I'm thrilled that you can join us today, and I'm more thrilled that it's my great pleasure to get to introduce our 2025 Bray Health Leadership Lecturer, Dr. Kimberly Harmon. Without a doubt, Dr. Harmon embodies everything that I think Tammy thought about when developing this lecture series. She is a renowned expert in sports medicine with a remarkable career predominantly dedicated to the health and well-being of college athletes. A former student athlete at the University of Notre Dame, she has built an illustrious career advising and serving organizations such as the NCAA, Pac-12, and NBA Players Association, as well as several parent advocacy groups, including the Nick of Time Foundation, Parent Heart Watch, and Who We Play For. Currently, Dr. Harmon is a professor in the departments of family medicine and orthopedics and sports medicine at the University of Washington, where she also heads the sports medicine section. Since joining the university in 1998, she has been a team physician for multiple teams, but most notably, she was just the second female Power 5 football physician and has served as the football team physician for an impressive 26 years. She's an accomplished researcher whose work has led to significant advancements in the prevention of sudden cardiac death, concussion, and other critical health issues affecting athletes. She developed the University of Washington NCAA Athlete Death Database, which has driven important health policy changes. In addition to her academic and research contributions, Dr. Harmon has held numerous leadership roles, including president of the American Medical Society for Sports Medicine and chair of the Pac-12 Student Athlete Health and Wellbeing Initiative. She currently serves as a member of the NFL Head, Neck, and Spine Committee, the Knight Commission on Intercollegiate Athletics, and she is the Deputy Chief Medical Officer for the National Hockey League, though we learned earlier today that will soon change to be just the Chief Medical Officer for the NHL. Her dedication to athlete health and safety is inspiring, and we are fortunate to have her here with us today to share leadership lessons. So please join me in welcoming Dr. Harmon.
you. Can y'all hear me with this mic that I've got on? Um, that introduction, Mark, that's a lot to live up to. So now I'm feeling intimidated. But it is such an incredible pleasure to be here and to honor Dr. Bray's legacy of visionary leadership, mentorship, and teaching excellence, as well as sort of innovative research. And so I'm really just so honored and pleased to be here. Thank you, Mark and Dean Zetterstein, for inviting me. So, what I'm going to talk about today is I'm going to talk a little bit about sort of my path and lessons that I've learned along the way. And then I'm going to switch up a little bit and talk about college sport and the state of college sport today, which is really an area that is in significant need of some visionary leadership itself. All right, guys, it's 1972 and I'm 6 years old. And Santa Claus has just brought me a life-size doll, and it's got all these little outfits with it. And I'm putting them on because the outfits are life-size. And I put on the nurse's outfit, the little white cap. That's actually me, my mom on the side, and my little sister. And I announced to everybody in the room, I said, I am going to be a nurse. And my mom looks at me and she says, why not a doctor? I thought about it for a second and I'm like, all right, that sounds good. And from that moment on, my goal was to be a doctor. And, I didn't realize this till years later, but my mom had wanted to be a doctor when she was in college. This is in the 1960s and life and family, and it was just a harder thing to do. But she really opened my mind up to the possibilities of what could be. And she actually instilled in me an unshakable attitude that I could do anything that I wanted to as long as I worked hard enough. And one of the things that I wanted to do, maybe, was go to the University of Notre Dame. Now, my family was a big Notre Dame family. I was talking with Mark Hoffman earlier. My mom was from Southern Indiana. My grandfather graduated from the University of Notre Dame in 1930. My uncle graduated in 1967. And I don't know if you guys know any Notre Dame fans, but they're kind of crazy. And my family was like that. And so later that year, after that Christmas picture, I said to my grandmother, I said, you know what? I'm going to go to Notre Dame. And she's like, no, you're not. They don't let girls in. You can go to St. Mary's across the street. And I said, I don't want to go to St. Mary's. I want to go to Notre Dame. I'm going to Notre Dame. She said, no, you're not. I'm like, yes, I am. And she's like, no, you're not. And that went on for a while. And pretty soon I realized that I wasn't going to win that argument. And so I kind of walked away. But under my breath, I said, sort of, watch me. And lucky for me, later that year, they let women into Notre Dame for the first time. And so I did end up going to Notre Dame. But both of those voices are important in life. The voice that says, yes, you can, and opens up your mind to new possibilities. And the voice that says, no, you can't. And you're like, have to find different ways to get your job done, and challenges you to find those different ways. So there's me in high school. I played a lot of sports. And when I was in high school, I decided that I actually didn't want to be a pediatrician like I thought when I was 6. I wanted to be a sports medicine doctor. And in fact, in my yearbook, I put that I was going to be the team physician at the University of Washington. My high school was in the Pacific Northwest, in a suburb of Seattle. And so went to high school, went to Notre Dame, and it was at Notre Dame where I decided that I wanted to be a football doctor. So I was they mentioned that I was a student athlete at Notre Dame. I kind of was. I walked on for a couple of years. I got beat up at practice, but mostly I was a student athletic trainer. And you can, I'm in some of those pictures. Give you a prize if you can pick me out there. But my senior year, we went to the national championship and actually won the national championship. And it was there that I decided that I really wanted to be a football doctor. That's where my love of football came from. And so what I thought was that I was going to go to Notre Dame, I'd go back home, go to the University of Washington, and I'd do some training there, and then I would be the football doc, and that would just be great. Life doesn't always work out like you think it might. And I didn't get into the University of Washington. They told me to go get some life experience. I felt I was experienced enough. And so I had other options. I got into some other medical schools. So I went to Indiana University School of Medicine, where I spent my first 2 years on the campus in Notre Dame. And then I did all my training in Indiana. And so it came time to get a job to sort of step into real life. And like the exact job that I envisioned wasn't available. What was available is I took a job at student health at the University of Washington. It was actually the worst job offer I received in terms of money and in terms of like opportunity. It was not an academic job. It had no formal involvement with athletics. I fortunately had a boss that was really supportive of wanting me to get involved with athletics, and gave me a half day a week to potentially do that. There was also, we taught residents there, so there was a teaching opportunity, and they had a fellowship that ran out of there. And so I went there and I looked at my husband and I said, we'll give it 2 years, because it wasn't what I wanted to do, but it was in Seattle, and I'd had my first kid during fellowship and really wanted to raise my children around my family and my parents in particular. So I went there, and there I met this young man, John O'Kane. He has been my colleague for the last 27 years. He and I are the same year in training. He actually did sort of a fellowship at the University of Washington. He was our first fellow there. It was sort of a made up fellowship and then they hired him to take care of the University of Washington athletes. The care of the University of Washington athletes had been with a private group, and they were just coming back into the University of Washington, and he was supposed to do that. And I told him that I'd help him. I think he got my resume from no less than 20 people, and he wasn't so sure about me. And so at some point he said, would you like to take care of the cheerleaders? And I said, sure, that would be great. I mean, the cheerleaders weren't even really officially varsity athletes at the time. I soon learned that they really were athletes. I had a little bit of an attitude when I went into that situation, but came out of it better educated. And that went okay. So before too long, he's like, how about women's volleyball? That would be great. And then he said, how about women's basketball? And I'm like, yep. And so on. And pretty soon, by the end of the year, we had basically split up all the teams at the University of Washington, and I was taking care of half of them, and he was taking care of half of them. Now, you notice on that picture that there's no football. And that's because when we took over the care for the University of Washington, the old group still had control of football and men's basketball, and strangely softball. And the year after I got there was a coaching change in football, and we got a new coach. And with the new coach, we got back the care of the football team. And so when we got back the care for the football team, I said to John, I'm like, I want to help with football. And he's like, okay, that's great. I need some help. And it wasn't like everybody was not super thrilled. The sort of old guard, particular the athletic trainer at the time, wasn't super psyched about there being a female in football. But John really went to bat for me, and sort of that's where it all started. And so I was pretty happy about that. So I started with football in 1999. At this point, it's been, as Mark mentioned, I've been 27 years at the University of Washington, 26 in football. I've had 8 head football coaches. I'm on my 8th head football coach. My current head football coach was, I don't know, he was giving me some problems. I said, Coach, like, you're my 8th head football coach. The last 7 and I got along great. I'm sure we're going to get along great. And if we don't, I don't think it's me. I'm not sure he appreciated that, but I kind of felt like it was the truth. 6 athletic directors and 5 UW presidents. And it has been a terrific ride. It's been a terrific ride. So much opportunity, so many great colleagues that I've been able to work with. But it really hasn't been all sunshine and roses. There have been things. I remember about 10 years after I'd been working for about 10 years at the University of Washington, the Seahawks were looking for a new doctor. And they asked my partner, John O'Kane, if he wanted to do it. And he said, no, I like college athletics, which was fair. And so I was waiting for them to ask me, and they never did. Instead, they asked my younger partner, one of my old fellows who I'd hired, his only football experience. I had a decade of college football experience at that point. His only experience was sort of the year he spent on the sidelines with me. And I was told by one of the physicians that was sort of in charge of hiring for that position that the NFL wasn't ready for a female physician at that point. I hated to tell him that there are already a couple orthopedists, female orthopedists that were doing it. But, I don't think that I wanted to do professional football. Like my heart really is in college athletics, but I'm kind of pissed that they didn't ask because they should have. I was the most qualified person. But there's also been times where I've been asked to speak or be on panels or be on committees because I've been female and they've been looking for gender balance. And, so you win some and you lose some, and you take advantage of the opportunities that are there for you. You can't sweat too much the ones that aren't, and just do the best you can with what you have to work with. So this is my good friend, Cindy Chang. She was the first female team physician at a Power 5 school. As Mark mentioned, I was the second, which kind of feels not that great. But I came along in 1999, and it was great to have Cindy there before me. She is a friend of mine to this day. I wasn't the last, though, particularly in the Pac-12. It was almost a decade later, more than a decade later, actually, that Sunday Henry started with football at Washington State. And then not long after, Cindy did football at Cal until 2010. And then they hired Lindsay in 2013. And then in 2014, they hired Shannon Lancaster at ASU. And so in 2014, fully a quarter of the Pac-12 team physicians were female, which it was pretty cool. And they sort of came to me, this group of young women came to me as sort of the older person in the group and said, Kim, we've got something we want to talk to you about. It's just not fair. There's no place for us in the locker room to go to the bathroom. So, and it was true, there wasn't. So if I had to go to the bathroom during a football game, at halftime, I had to run up into the stands, and sometimes I'd show my pass and say, "Would you mind if I cut?" So that I could get back down by the end of halftime if I wasn't super busy, or wait till the team left and then use the bathroom that 120 dudes just used. And my first reaction was like, oh my God, don't make waves. I mean, I had been successful in college football, I think mostly because my attitude was just put your head down, do a good job. People won't notice that you're a chick, and eventually they'll notice that you're good. And so that was my theory and how I'd survived till then. And they were asking to make waves and actually ask for something. And it was really educational for me because at first I said, hey, I just deal with it, And then I'm like, you know what? Actually, that was sort of 10 years ago. It's more than a decade later. And we deserve a place to pee. So, I actually took a picture of this because this is the first time that I ever ran into a female locker room or a female dedicated space in my career. And it was at the Pac-12 championships in 2023. And so it took a while, but it happened. Progress oftentimes takes a while. And I'll be happy to tell you that in the Big Ten, they now require that there be sort of female locker room space for female staff. In almost all the professional leagues, they require that as well. And so it's nice that people are even thinking about it. Sometimes, you get into an old stadium and it's not ideal, but it's nice that they're even trying. So we're making progress. So I'm going to shift gears a little bit and talk about the Pac-12 and the Student Athlete Health and Wellbeing Initiative. And I'm talking about the old Pac-12 before the realignment. So in the Pac-12, there had always been a medical meeting, and usually an athletic trainer and a doctor we'd all go somewhere once a year and meet, and we talk about case studies and best practices. And we were specifically asked by the athletic directors not to give them any suggestions. And it was funded by vendors. And so mostly the athletic trainers would go out and sort of get vendors, and it was fine. And it was a way to sort of meet your colleagues and things like that. With the advent of the college football playoff, there was an additional $600 million that came into the college football ecosystem. And about 70 million of that went to the Pac-12. And the Pac-12 was actually like visionary, first, only person that said, we are going to dedicate $300,000 from each institution. So there's 12 of us, $3.6 million a year to the health and well-being of the student athlete. And we're going to give it to this sort of loose kind of committee that we've put together. And so, I mean, that was a lot. We went from zero and don't tell us anything to here's $3.6 million, have fun. And most of that was really supposed to be dedicated to a research grant program. And so with that money, we did a lot of stuff. And probably one of the most important things that we did was we put together a conference-wide injury and illness database. Now, that doesn't sound very exciting, but every single school got on the same database. We used the same data elements, and it all went up into the cloud. And then we could get that information back in. And so instead of looking at the 3 ACLs a year that you have at your school, we could look at the 50 that we had in the Pac-12, and we could find things better than that. You can also, by the end of the deal, you could sort of, but by the end of it, this was like a development. It didn't all happen right away. You could say like, oh, we've had a lot of shoulder dislocations this year. Is it really just seem that way, or is it really that way? And so you could compare how many I had at the University of Washington to how many they had elsewhere. I couldn't see if it was Oregon State or UCLA, but I could tell against sort of the conference average and the different teams. And at the time that this started, we started this in 2015, the NFL didn't have this type of system. They were on paper and pencil. The NHL was just starting theirs. No other conference since ever has had this sort of thing, but it is now standard in professional sports because you can't talk about injury prevention until you know sort of what's going on, right? So the first step in sort of figuring out how you're going to prevent something is figuring out what's going on. And so this was really, really groundbreaking. The other thing that we did, and this has been sort of the initial intent, was we started a research grant program. And it was really robust in terms of we had reviewers, we had a full cadre of reviewers, we had lots of applications. And so if you were a Pac-12 researcher, you could apply to us for a sports medicine grant. And there was no sort of limit. So we gave out small grants, we gave out large grants. And over the 10 years that this was in existence, we gave out $18 million. There were 33 different funded grants. And that's not including sort of grants that we gave to students to sort of come to some of our meetings. And I was just talking to somebody early this morning, and they were mentioning sort of like, where do I get money to study sports-related concussion? Like, that's not a huge topic that the NIH really is super interested in. And so this was a great opportunity for Pac-12 researchers to do sports medicine research. And I mourn the loss of this program and just the old Pac-12 in general. Other things that we did with that money, we put together the concussion coordinating unit. And what that was is at the time, the NCAA and the Department of Defense had put together a program to look at the natural history of concussion. Much of the concussion research that we have is from that program. And there were two schools in the conference that were feeding information into that. But what we did is we made all 12 sort of feed information into that. And the NCAA partially funded that. So that was great. We're just not getting money from the 12, but we were also getting it from other places too, to do the research that we needed to do. Mental health has become a big issue of late, and we put together the mental health coordinating unit. And with that, we looked at sort of screening mental health in athletes and how do you do this best? And does the stuff that they're recommending work? And so really put an emphasis on mental health. And so that was important too. And then we had, I told you about the sort of little conference that we get together and maybe golf and talk about cases. We put together like a really robust annual health and wellness conference that highlighted the research that we were doing, that had speakers about important topics to educate. And we funded 5 people from each school. And that included a team doctor, an athletic trainer, a nutritionist, a sports psychologist, and somebody else. And a lot of schools also sent, more people. And so we get 150, 200 people at this conference, and it was interdisciplinary, and it was really great. And that's the only picture I have that's appropriate for this sort of talk to put up there. And we also put on 2 other conferences. We did a mental health conference in 2019 that was, again, co-sponsored by the NCAA. And that was open to anybody in the NCAA. We sold out that conference, and so had to stop enrollment on that, and that was terrific. And that's Brian Hainline, the chief medical officer of the NCAA at the time, talking. And then we put on a health equity conference in 2022, which was sort of equally as well attended. That one was particularly cool because we had a lot of students and student panels talking about sort of their lived experience and things that we could do moving forward. And so the educational stuff that we put together through the Student Athlete Health and Wellness Committee was awesome. And so I was the chair of that from 2017 to 2019. This guy right here, Doug Ackerman, Doug's here in the audience today. He was the chair from 2019 to 2021. And some of you may remember what happened during that time period, but COVID. And I don't want to give anybody PTSD, but on March 10th of 2020, we stopped the NCAA basketball tournament and shut down sports. It was going to originally be for 2 weeks, if you remember. No crowds, no roar, anything like that. And what Doug did at that time, and we did in the Pac-12, is we put together a COVID advisory committee. And so we were trying to figure out what to do. The COVID advisory committee consisted of infectious disease doctors from around the conference. And I can remember the first meeting or two, like the infectious disease doctors are like, you guys are sports docs. You don't know what you're doing. You're trying to kill these kids and give them COVID. And we're all sort of like, you guys are infectious disease docs. You don't get it. And, by the end of our time together, we become good friends, great colleagues. And I think that we both learned a lot. We're on a common path. We worked really well together. We also had public health officials, and then we had different liaisons. And so there are many people in the Pac-12 who did other things besides work with our Pac-12 student athletes. They worked with the NBA or NASCAR or different places. And so the NCAA, we had people that were on the competitive safeguards from the NCAA. And so we brought them in too, so we could try and figure out how is everybody else trying to deal with this and get some ideas about how we might move forward. And so that was really amazing. And we were on Zoom calls like every day during this time period. We also put together, or I put together, Doug said to me, he's like, well, the commissioner said that they're doing this in the SEC. And I'm like, gosh, like sports medicine is a small world. I'm like, I don't think they're doing that in the SEC. I just talked to so-and-so. And so we decided we'd put together like a group of people from the different conferences. And I literally had to print out a list of the different conferences. I mean, I didn't know who was in the ACC or the Big 12. And so I printed out that list. I'm like, I know a person from there. I know a person from there. And initially we just started emailing each other. And then somebody said, do you want a Zoom meeting? And I'm like at the time, we're like Zoom was new and we're already Zooming to death. And like the last thing I wanted was another Zoom meeting. But we met every Thursday throughout the course of the pandemic. And it became a huge source of support. I sometimes call it my Power 5 support group. And it was really informational in terms of how different people were dealing with different problems. And you'll see down there that young man right there, James Bray, I didn't realize he was Tammy Bray's son, or I might have been nicer to him. But he was part of that support group and has been a good friend for years. And so that was great. And so, we're March, we shut things down. April, we're like, it's going to be a couple months. We bring the students back in June. And then in July, we started hearing about the potential cardiac effects to COVID. And we're hearing, out of some of the universities in the Midwest that up to 40% of the athletes have serious cardiac problems. And we're like, oh my gosh, what are we going to do? We can't expose our athletes to this sort of potential trauma. And then on August 10th, the Big Ten says, we're not playing for fall sports. And the next day, the Pac-12 says, yeah, we're not either. And we had talked with the chancellors and the presidents. This is like the only time in my life that I'm talking regularly with chancellors and presidents about the fact that if we could get a hold of some rapid tests, that we could potentially get the athletes on the field. If you remember during this time, it was hard at that time to get a PCR test. And there was only 2 places in the Pac-12 that can reliably get a 24-hour turnaround time on a PCR test. And so if we're trying to test people so that they can go out and practice safely, PCR test is not going to do it. And so we had people were talking about, well, if you can rapid test, they're not as sensitive, but if you do it more frequently, it's just as good. And so this was the theory. And we had talked with everybody about it, and big uproar. Oh no, college sports is done for this fall. And then the Pac-12 was able actually to work with Quidel, which is a rapid testing company, to get rapid tests for the Pac-12. And part of that agreement was that we would study whether or not they worked, right? So we'd also do PCR at the same time, and we'd study whether they'd work. And we actually got them to, we had to pay for the test, but we got them to pay for the research. And we also hooked the Big Ten up too, which was like solid. So, in places like the SEC, where James is from now, they hired people to do the rapid testing. But in the Pac-12, it was our athletic trainers. Many times, we ask so much of our athletic trainers, they always do more. But we put together we had to get, approvals for the labs to come together. And we put together like testing stations. Everybody would come through. And the Quidel test, unlike some of the ones that we're used to now, you had to put it into this little reader. And we got the reader to hook up to our medical record that I talked about. And so all those tests went into the medical record. And so then we could follow sort of conference-wide what was happening in terms of positivity and all that sort of stuff. And in February of that year, I think we sort of stopped gathering our data, and we looked at it, and we had 123,000 rapid tests that we'd done, because we were rapid testing our athletes every day to get them on the field. At the same time, we'd also done 23,000 PCR tests to make sure that we weren't we're kind of using both at the same time to make sure that we weren't going to kill anybody. Although cardiac stuff turned out to be not that big a deal. And what we found out was that really the antigen test, doing the daily antigen test, prevents spread. We didn't have any outbreaks that were related to doing the antigen test instead of PCR. And we also found out that the antigen test, doing daily antigen test, was equal to about doing 2 to 3 times a week PCR. And some of this research and what we were talking with about with the CDC and other places is really what got people not just back to life, but back to sport. And so this was really important and groundbreaking stuff that we did. We also were part of the ORCA study. The ORCA study is the Outcomes Registry for Cardiac Conditions in Athletes. I'm one of the principal investigators on that. And it initially started to look at the cardiac effects of COVID. And so we collected data from anybody who would give it to us. And And we ended up getting data from 42 colleges and universities, 23 states, 14 different athletic conferences. And and it represented a total of almost 20,000 athletes at those schools. Of them, 3,000 had COVID. We had all the ECGs that they got. We had the echocardiograms. We had all the testing that they'd gotten. And what we found out is it wasn't 40% of our athletes that had cardiac complications after COVID. It was 0.3%. So it's not zero. I mean, that's 1 in 300 about. But we also found out that the clinical course was generally pretty mild, and helped, again, get us back to life. We took that same data, the data that we were collecting from all those rapid tests, and we gave it to the CDC, and they analyzed it, which was way better than us analyzing it. And they used that data. The data that we provided them actually ended up being 50% of the total data they analyzed it. They got it, I think, from, I can't remember how many schools, but we had this big, chunk of data because we had this automated medical record that I told you was so cool. And it was responsible for changing the quarantine length from 10 days to 5 days. You're welcome. And so the stuff we were doing in Pac-12 was important to everybody. So now I'm gonna honestly, we really need that sort of vision and leadership in college sports today. I hope that the new Pac-12 also dedicates, it was run on volunteerism, but it needs money. It needs resources, right? But gosh, give a couple of athletic trainers and a few doctors some money and look what happens. We can do great things. I'm going to talk now a little bit about my work with the Knight Commission. The Knight Commission was started in 1989 to address sort of rampant sort of academic scandal in college sports. Athletes weren't graduating in football, and particularly men's basketball. And the one of the co-chairs at the time was Father Ted Hesburgh, who's sort of a hero of mine. He had been the president at the University of Notre Dame when I started, and was also the guy that let women in. Thank you. The other co-chair was William Friday from the University of North Carolina. And they got together a commission of presidents, mostly, and addressed the college, and it's part of the APR and the different graduation standards in terms of the NCAA primarily adopted all those recommendations. And so I just threw that in because I love that picture. That's Father Ted with my family. It must be about 2002, judging from the size of the kids and the fact that I'm not pregnant, because I have 4 kids. So the purpose of the Knight Commission is develop, promote, and lead transformational change that prioritizes education, health, safety, and success of college athletes. And I'd encourage you to go to their website. They have all sorts of interesting information. I'm going to try and distill this a little bit. It's hard to sort of know what to talk about when you start talking about what's going on in college sports right now. So I'll do my best. So it is a pivotal period in college sports right now, and particularly yesterday was a big hearing, which we'll talk a little bit about. I mean, it's driven by conference realignment. It's just like crazy. Like, I'm traveling to Rutgers this year for football. That's like some of it. That doesn't represent the whole picture, but conference realignment, media rights deals, it's just really changing everything. In addition, in the last 2 or 3 years, name, image, likeness, or being able to pay athletes for their name, image, likeness has changed everything. And it's a wild west out there because there are no rules regarding that. And then there's been lots of legal challenges, of which we'll talk about one of them. So I want to talk a little bit about the finances of college sport. And I may walk around to these little screens because my screen up here is not working. March Madness generates $1.1 billion. And of that, $400,000 goes back to the NCAA, and they run the NCAA enforcements, and they also put on 90 championships in 3 different divisions. That's the job of the NCAA, is to put on championships. The rest of it is distributed back to the Division I schools. There's a formula in how that gets distributed back. So it goes back to the member schools. The college football playoff brings in about $1.3 billion. And of that, $1.1 billion goes back to 67 Power 4 schools or Power 5 schools, however you want to put it. None of that goes back to the NCAA. The NCAA pays for rules enforcement. They pay for all the litigation that's related to football, the concussion litigation. But the NCAA gets nothing from the college football playoff in terms of money. If you look at sort of Division I, sort of the revenue in different Division I, the point of this slide is not to sort of bore you with sort of like statistics, but there's a lot more money in sort of Power 5 or Autonomy 5 schools than there are in other schools. And so when we're talking about solutions for this, it's a little bit hard to figure out how something's going to work for people with some drastically different financial situations. And when you look where the money comes from, you can see that in the non-Power 5 schools, most of the money comes from either institutional support or student fees. So that's the red and the orange there. And almost none of that comes in a Power 5 or Power 4 school. Most of the money comes from conference distributions, which include media rights, sponsorships, that sort of stuff, in Power 5 schools. And so I want to just show you some stats that kind of blow my mind a little bit. If you think about what it costs to keep our college athletes on the field, on the court, wherever, that includes, scholarship, meals, medical expenses, medical insurance. There's sort of one bucket of expenses. If you compare that against what it costs to pay for 11 college football coaches, there are 11 named college football coaches. Nowadays, there's a lot more football coaches than that, but there's only 11 named football coaches. The brown is the football coaches and the expenses of the football coaches, and the red is the expenses of the college football, or not football. That's all the athletes at all the schools. And so 11 coaches cost more than all the aid that's given to all the athletes at a school at 9 schools in 2022. Means that what you're paying those football coaches costs more than you're paying all your athletes. And it's forecast in 2030, if things don't change, that half of the Power 5 schools will be in that situation where we're paying a lot to college football coaches. And so that's part of the problem right now, is that we're paying coaches so much, right? The other part of the problem, again, I don't want to bore you with statistics, is that when we fire coaches, we continue to pay them. And so last year, we paid almost, or in 2022, the last year we have data from, we paid almost $100 million to coaches that have been fired. I think the best job in the world right now is a fired college football coach. That would be awesome. And so we're a tremendous amount of money is going into fired college football coaches. So I talk a little about sort of like the situation now, and then I'm going to talk a little bit now about where we are, and in particular, the NCAA versus House settlement. Who has heard about that in here? So some people. So the House is it's not like a structure; it's a name of the defendant, or who's ever. I don't know what the opposite of defendant is. The guy who's suing the NCAA. And it's 3 suits that are like rolled up into one, basically. And there was just a hearing yesterday to decide if they were going to say that this is okay, and it's under consideration right now. And so basically, the 5 Power 5 conferences, the ACC, the Big 10, the Big 12, the Pac-12, and the SEC, are being sued by athletes from 2016 to 2024 for the use of their name, image, and likeness, which they did not get compensated for because we couldn't pay athletes then. And there's 3 sort of arms to it. The first arm is back damages to those people that we didn't pay for their name, image, likeness. And so the settlement, if it goes through, will pay $2.8 billion to the athletes that we didn't pay before. Of that, 90% of it will go to football and men's basketball. 5% will go to women's basketball, and 5% will go to all the rest of the athletes. It also proposes a new model for sharing benefits for athletes in the future for their name, image, license, which we'll talk a little bit. And then there's new requirements. There's some actual rules about NIL money and how you can get paid for that. Because right now there's no rules. You know, you can your booster can say, hey, here's $2 million, and I'm going to pay for your name and image, likeness, and not do anything. And I mean, you can just pay athletes right now if you want to. So the new model for athlete benefits basically means that schools can pay the athletes because of the benefits they get from them. And there's a cap on that. And that cap is basically $20.5 million. And so if you are one of the Power 5 institutions, or if you're one of the other institutions that opts into the settlement, it's a salary cap, basically. And so you can pay your athletes. And it doesn't say how you can divide it. Most people think it'll be divided along the lines that the back pay settlement's going to be divided. But you don't have to pay athletes that much, but you can pay athletes that much. And so it's trying to level the playing field a little bit in how much we're paying athletes. This, I think, is a big thing, is that there's new requirements in terms of how the athletes get paid for their name, image, likeness. And so basically, if an athlete gets more than $600 in total, so if they get more than sort of a water bottle or a t-shirt or whatever from the company that is sponsoring them, they have to report it. And that money is subject to a fair market value assessment. And so somebody's going to say, like, is this like real? Like, are you really getting paid for something, or is just kind of pretend? And so it will bring some more, I hate to use the word integrity, but some more, I guess, guardrails around NIL compensation. And so what will happen, again, if the settlement goes through, is that now we still have the $400 million that needs to go to run the NCAAs and all the 90 different championships that it supports. But $160 million of that March Madness revenue is now going to go for the next 10 years to pay the athletes, the back pay, to pay the settlement. So, which means that all the member institutions are going to get less money. They get about they get $160 million less. And they also have to pay their share of the settlement. So they've got to pay into that athlete sort of settlement as well. And now they're paying athletes too, $20.5 million. So it's really going to affect sort of budgets at schools. And meanwhile, over here at the college football playoff, they get $1.3 billion. And that money just goes back to the 67 Power 4 schools. And again, the NCAA is still footing the bill for their legal cost and their rules enforcement and all that sort of stuff. So that's just a little bit of the landscape of sort of what's going on with college sports. And I haven't even touched on gender equity or racial equity or a lot of the other sort of elements that surround this. What are the solutions? Because I just don't want to tell you. I'm going to give you some solutions. I wish, if anybody actually tells you they have some solutions, I'm not sure you should believe them. But I think that when we think about solutions for this, we need, this is an area really leadership and vision, and the things that Dr. Bray stands for are really important. We need to realize that there's an intrinsic value to participating in college sport. There's health, there's exercise. College sport was a huge driver of women's participation in sport with Title IX. I wouldn't have played all the sports that I did without that. It's a huge instigator of diversity. And many Division III schools, that's where they get a lot of their diversity, is from athletes. And it gives so many opportunities to people that will never have opportunities before. And so there's just a great value in college sport for sport, and then the education that accompanies it. But we need to realize that a one-size-fits-all approach is not going to work. I already told you how different just the little subsections of Division I are. gosh, when you start talking about the difference between the divisions, I think that this is interesting that about a third of the athletes are Division One, and that includes the breadth of Division One, but only 57% receive aid. And so one of the main issues when people were talking about the settlement, when they were at this settlement hearing today, is they tried to put in something called roster limits, which means if we're going to pay athletes, you can only have so many athletes. And what that means is that a lot of people that are walk-ons at different places won't have a spot anymore because you can only have 15 women's basketball athletes. And so if a team has 25 and 10 people are happy just to practice and sit on the bench, that was me, they can't do that anymore. In Division Two, which is the smallest of the divisions, about 60% of the people get aid. Most people in Division Two get partial scholarships. They divide up the scholarships a lot there. And then Division Three is actually where most of our NCAA athletes are. They're not where it gets all the headlines, but that's where most of the athletes are. 1 in 4 students at a Division Three school is a student athlete. And they don't give any athletic aid, but 80% of those athletes get some sort of academic or financial aid. And for many, many Division Three schools, that's what drives their enrollment: the opportunity to play sports and the opportunity to get an education. And so, a solution that works for a Power 5 school is not going to work for a Division Three school. And we need to recognize sort of the 800-pound gorilla, the elephant in the room, is that big time football, there is a ton of money and it's going up. It's going up. If we expand the playoff, additionally, new contracts, that sort of thing. And right now, ESPN and Fox Sports are calling a lot of the shots in terms of conference realignment. The reason that Cal and Stanford aren't in the Big Ten is because Fox didn't want to be, and Big Ten didn't want to split the money, right? You gotta split it. And the interest of some of the people that are calling the shots right now may not be the same as the interest of college presidents, or students, or student athletes, or fans. And somehow we got to be able to influence sports so that the integrity and the goodness of college sports is still retained. I mean, I think most people think, and I think, that big time football needs to be its own entity. It needs to be pulled out, sort of, kind of a different playing field, if you will, and kind of stop ruining the rest of college sports. I don't know why my volleyball team has to go to Rutgers because I do. That's not great. The NCAA really shouldn't support the CFP in the ways that it does. It should spend that money where it needs to. And there needs to be a cap, not just on what we're paying athletes, but what we're paying coaches. Some sort of luxury tax system that puts some rules around what's out of control right now. Out of control. And then the next issue is basketball, because basketball is the other big revenue sport. And it's not just men's basketball now. The last women's TV contract was huge. And the concern is if football leaves the NCAA, or even if it's within the NCAA, and then basketball leaves, and then there goes the revenue, and then what supports the NCAA. But we have to be not afraid of what could happen, but sort of look for solutions based on the realities that are. And so, I guess, again, I don't have any great solutions, but now is a pivotal time in college sports, and we need great leaders and thinkers that can think about new and different ways to do things, and be brave about the future. And so I'll end with that, and take any questions that people have. And if you want to learn more about the House settlement, that's a QR code, or you can just go to the Knight Commission website. Thank you.
So we'll go ahead and take questions from the audience.
Like Oprah?
Just like Oprah. We'll take them.
Thank you. I have two very different questions. First, you got started in sports medicine back before the big DEI movement. and you were able to see and all that. I was wondering, what impact has the DEI movement had in your area, and what is the demise of DEI likely to do?
Yeah, so there are a lot more women in the locker room and in the football facility than there used to be. When we redid our facility, there was women's locker room and it had lockers in there, and I was the only one there. And there was one bathroom, and now like locker space is at a premium. There's not enough lockers for all the women. And we need more than one bathroom, and it's just great. And at Washington, our head athletic trainer is male. All the other athletic trainers and our physical therapist are female. We call ourselves #girl team, which is only a problem like if we have to go into the locker room, we try not to. We can walk in there when people are all naked and stuff, but we try not to. So just, in the NFL, there's been a huge push towards having females and diversity in the NFL. The NHL is diverse in its administration and the actual sort of care of the athletes. It's lagging behind. They just hired the first sort of full-time female coach in the NHL. There's no athletic trainers, but the Seattle Kraken hired the first. So definitely see a lot more females. And like I said, even in the Pac-12, we've got a lot more, and it's not, it's not strange anymore. And I don't think that coaches or players or anybody is shocked or think it's weird. I think it's just like part of life. I don't know how sort of changes, and like the problem has always been the pipeline, particularly as you get into more racial diversity. And so I hope that the pipeline remains open because that's really important.
Let's pause and allow somebody else to ask a question. We come back to you later if that's okay. Thanks. Matt?
Thank you. Very interesting talk. How do you see the role of the physician protecting the student athlete's health in the coming years as so much pressure is being pushed on? Get this athlete back out. We're making money, things like that.
Yeah, that's something that's really interesting, right? Because as a physician or a healthcare provider, you kind of have a duty to the patient. That your duties to the patient, unless it's other, and if it's not, you need to tell them, right? And so in the NHL, it is written in actually the collective bargaining agreement that during the pre-participation examination, the duty of the physician is to the club. But other than that, it's to the physician. And the physicians are instructed to tell the patient that, right? Sometimes people come in and they've got the positive review of systems on their sort of entrance physical. I'm like, look, dude, I'm trying to disqualify you. like, are you sure you want to tell me about every time your elbow's ever hurt? So I think it's important. Like you have to always keep in mind that that person's sort of your patient. I always think of them as one of my sons. And sometimes I'll say like, I wouldn't let my son play. And sometimes people don't care. But the other thing is I think one of the things that's unique about being in a sports type situation, particularly one that's higher level, is that the risk calculation may change, right? And so me holding out a high school kid because of whatever is different than me holding somebody who draft stock may be affected, right? And so it may be reasonable with informed decision making for somebody to go back with a little more risk as long as they know that. And so I think really getting into the whole area of shared decision making. And I've said to patients, to athletes before, your hamstring, is pulled, whatever. You can go back. It's pretty good now. You can functionally do anything, but it's kind of early and you might pull it again. If you pull it again, you're going to be out for the rest of the season. Or you could wait a week or 2 weeks and then you'd be better. But this might be a really big game coming up, right? And so, like, you want to risk it? Do you not want to risk it? You have to be careful when you sort of have those conversations with people, because I don't know if you know this, but young adolescent people, particularly men, are bulletproof, and may not be able to accurately assess risk, but you need to have that conversation. And there's been other times I say, like, hey, if you want to wait another week, I will tell coach that you're out. Like, I'll take that for you. And so I think that you need to build trust. It's getting harder to do with now people like ask their agents. And it used to be, I think, almost more of an issue when it was sort of a team, and people were playing for the team. And now, like, people are like, they don't want to hurt the product. So they may be like, yeah, I'm not playing. Like, like, I got whatever coming up. So there's a different calculation, I think. Some of my colleagues here probably have some similar thoughts. But I think you need to be upfront about where your loyalty lies. And you need to know that in your mind, too.
Other questions?
I mean, if you're not willing to be fired, you shouldn't be doing this job. Like, somebody once said you should have your resignation letter written before you start the job, so you can pull it out and use it at any time.
Thank you for sharing all this with us. How have the supports for mental health specifically changed from what you're seeing? And is it starting to get handled more in-house through athletic departments, or is it still kind of go to university health services?
It's different everywhere. So, like, the thing that has changed is sort of the amount of focus and attention, and the resources that are directed towards it are, vastly increased from what it was 25 years ago. Also, sort of the attention and the willingness of students to sort of engage with it is also changed considerably. It used to be sort of like, no, I'm fine, whatever. Now it's like everybody needs a therapist. Like, and so the with the Pac-12, we originally sent back $100,000 per year to each institution, and initially we were like to hire another mental health provider, but some people are like, no, we use campus health, so we don't want to do that. We want to do something else instead. And so we couldn't do it for one purpose, because it's like so heterogeneous in terms of how people deliver mental health care at different places, that it's different. And so some places use student counseling services. Some people have, like, 4 go-to people in the community that they use. Some people hire people, and there's benefits to all of them. Some students don't want to see the person that they tell all their secrets to sort of standing next to them on the sideline. And other people, like, would prefer to tell people their secrets on the sideline. And so I think having a variety of options is important. But the amount of attention that's being paid to it now is certainly increased by leaps and bounds.
Got a question from Sean here. Sure. I'm thinking back to your introduction, and in truth, my response was, "When do you sleep?" So I'm thinking about a question as it relates to leadership, and thinking about how do you manage so many diverse demands on your time, and thinking about casting a vision versus enabling other people to act. I'm just curious in the context of thinking about leadership.
Yeah. So, one of the nice things is I've had a fellowship, right? And so you've got, like, cheap, eager labor with that. And that's always a bonus. A lot of people have asked me sort of why I'm stepping back from football. I obviously sort of love it. I've got other things to do, but part of the reason is you need to step back from leader positions to give your younger colleagues a chance, right? If you just, like, sort of sit there, you need to give other people opportunity too. People did that, for me, and so I think getting out of the way to let other people do their thing, and then letting them do their thing, right? Actually, you also sort of, like, ask about sort of how you do it all, and I would say that you don't. There is not like, it's great because my kids are all grown now; they're in their 20s, but gosh, I'm really good at guilt, and there is not a time that I ever didn't feel bad about something that I wasn't doing for my kids or that I wasn't doing at work. And I think what you have to do is just give yourself a little grace and do the best that you can, and go from there, because it's enough, you know. Um, yeah. I mean, I miss some of my kids' games, and they still like me. Um, and they got some opportunities. You know, every year at the end of football season, I would say, you want me to keep doing this?" And we'd have a family chat about whether it was something that was worthwhile for the family. I mean, my husband, he's a saint. Like, he like took care of the kids and the dog while I traveled all over the place. And so having a great partner in life is important. And and I, I I always feel like I'm more aspirational than I have big goals, and I get about 80% of it done, and that's like okay. You know, you can't sweat the other stuff. Yeah.
Okay, it's a bit of a long one from Steve Spurgeon. With the introduction of NIL deals and the pressure for athletes to continue playing as a source of income, what is the view on college athletes who have suffered multiple serious injuries but remain in the college system? For example, the Utah quarterback, a seventh-year senior with several serious injuries, continues to play and sustains additional injuries. What is the role of colleges in determining when it is time to say enough is enough, and has this been discussed?
I mean, I think that there's a broader question in there about like who gets to decide what's good for an individual, right? And so the sort of old model of medicine was very paternalistic, where I got to decide who got to play and who didn't. And now there's this whole thought in medicine that everything should be a shared decision. And so if somebody wants to go out there and do something that I think is stupid, well, it's their life, right? And I think there's a balance somewhere between the two. Certainly, with all the like, you know, you can play in JUCO and that doesn't count and all that sort of stuff. We're going to have athletes that are 30. It can be very profitable now to play in college. More profitable than people that might not have a real chance in the NFL. And there's a lot of again, hopefully, as we move forward in this new paradigm, we'll get some of that worked out. But I think that you know, I don't know. There's a lot of, and um I've struggled with this over the years, and it's changed. You know, there's people that I've disqualified, and I've been sort of comfortable and been right with, and there's people that I disqualified that said, "Thank you." No, they didn't say thank you. They said, um, it, disqualifying people that don't want to be disqualified is always hard. And but I've disqualified people that have then gone and played elsewhere and been drafted and are now making millions of dollars. And you know, I thought it was too dangerous for them to play, and they ignored my advice, and that, you know, has been life changing for them and their family. And why do I get to decide whether or not it's worth the risk? So I think there's it's hard. I don't know that I have the answers.
Okay, we can probably take one more question.
Thank you for your talk. I've learned a lot and really appreciate all that you've shared. And kind of combining a few of the last asks and answers, especially as the last ASOSU presidential pair really led getting a student athlete therapist to also open up more therapists on campus for other students. How do you feel, particularly maybe college football or the college athletic scene is doing in terms of holistic health, for maybe more athletes realizing like the climate crisis issues and all these other things, and we're in like the decisive decade, you know, global warming or worldwide warming is on the rise, and they start to realize that and maybe really struggle with kind of like what you were saying of, you know, how do I do my best, but maybe start moving onwards and saying enough is enough to put my energy otherwhere or in other places given the current situation.
Yeah, that is it is a tough thing for anybody who defines themselves as an athlete to become a non-athlete. That's why many of us become sports medicine doctors, um, and other things. But when somebody has a season-ending injury, so not just from sort of a crisis of conscience or that I want to do something else, but like football, volleyball, basketball, you name it, it ends for everybody someday, right? And some people don't have a great idea of who Joe is when he's not a football player. And so I think having our psychologist work with athletes and hopefully our coaches promote this too, but sometimes they're just worried about not getting fired. Um, although, like I said, that's a great job if you're a football coach. Um, to promote like having the plan B and the plan C and what is life after sport, because there's going to be life after sport. Um, I think most people, most of our student athletes right now are so overwhelmed just trying to do everything they need to do. They practice all the time. They're in film all the time. They're studying all the time. And then they're trying to have a life outside of that. That I don't think sometimes they have time to think about the other things. There's some amazing people that do, but you only can focus on so much. And kudos to the people that are able to focus on a little bit more, or maybe get to some of the important stuff afterwards. But yeah.
Excellent. Well, thank you all for being here. Thank you to Kim for this great lecture. A warm round of applause for Kim for this.